A very good evening to one and all. A special thanks to Dr. Shankar and organizing team for inviting me for this talk. So today I'm going to speak about the non-surgical and non-PAP modalities in managing OSA. Most of the slides that I'm going to show have already been discussed by one or the other speaker. I'm just kind of summarizing and collating all those modalities together in the next 10-15 minutes. This is something that all of us as sleep surgeons counsel our patients, isn't it? It's well documented that weight reduction helps OSA, especially when you're talking about a case with high BMI and when you have mainly the tongue base as a cause for the OSA. Weight reduction definitely helps. Myofunctional exercises is essentially aimed at improving the tone of the tongue and the pharyngeal muscles. As we know that during the REM sleep, that's when the muscles are paralyzed, that's when the apneic events are predominantly present. So when we work on increasing the tone of the tongue muscles, the tone of the pharyngeal muscles, this helps in preventing the collapse in the deeper stages of sleep. And though not a standalone management modality, as an add-on therapy, it helps for patients with OSAs, and it also increases the compliance of patients on CPAP therapy. There are apps available which help the patients and guides them through exercises wherein they are mentored about how to move the tongues and how to certain breathing exercises. In fact, our very own Dr. Sanu has an app, isn't it, Dr. Sanu? What's it called? Sorry, it's not yet launched. I'm sorry. Yeah, so he has got an IT background himself. In fact, he did some years of programming before getting into ENT. So he has programmed an app which helps patients follow step by step instructions and help them with their myofunctional therapy. And we just had Dr. Nivedita giving a wonderful talk about mandibular advancement device. Some things in mind is it has to be customized, and without proper customization it can give rise to TMJ problems. When a patient with mild to moderate OSA has a predominantly tongue base as a problem, this, and people who are generally prone to used to sleeping on their back, this helps prevent tongue base collapse, keeps the jaw in place. This is something that is very extremely useful, especially even for the primaries, for the snorers, young ladies, snorers who are not very compliant with CPAP, who don't have a very high BMI, who have a good nasal patency. They end up using this and they're pretty happy with it. We had one whole presentation on INAP by Dr. Janvi, who spoke about extensive about the intraoral negative pressure device. This is basically a device that has been launched, I think, about a year back in India, and the prerequisite for this, again, mild to moderate OSA, the nasal cavity has to be patent. This creates a seal, a negative pressure seal in the oral cavity. Few patients complain about numbness soreness around the tongue because of the continuous pressure that the tongue has over the dentition. A few of them complain about excessive dryness over a period of days because of using this. This basically sucks out even the saliva over the night. So early morning they've got dryness in the mouth. Apart from these downfalls, it's a good device. People who are not compliant with CPAP, and it's a very handy thing. It can be used even in flight. Some people are so embarrassed about their snoring that even in the flight when they are traveling, they have problem when they snore. The co-passengers get, they're irritated, and it's a nuisance. So there's something that is approved even in flight. They can carry it in the flight and use it when they are sleeping. Can't be used during meetings. Just because it solves the problem doesn't actually It's not intended to make you sleep in places where you're not supposed to sleep. Now it's a research-based product available in India. So till here, what I've spoken are the modalities that we have available in India. There are a few that I'm going to discuss now. Some are available in the international market, and some are still in the research and development stage. So this is something uh, that is available in the international market, not there in India. Essentially, it's a small kind of a nose plug which creates resistance during exhalation, and then that gives a moment of positive pressure which helps to keep the upper airway open. Then there's this nasopharyngeal airway stenting device made from retinol. It's been marketed as Alaxo stent. It's no longer actually available even in the international market, and this is quite difficult to use, especially because it has a. We just imagine the simple nasopharyngeal stent that we use in the perioperative phase after our OSA surgeries. We put a stent, isn't it? It's not very easy to tolerate for the patients because of the gag, and it's quite a lengthy tube that starts from your nasal vestibule down to it hangs up to the oropharynx. But then theoretically, if you look at it, definitely it prevents that area of collapse and keeps your airway patent. And then these positional therapy apps, which are there's a band which you wear around your chest, and that alarms and sometimes even vibrates when the patient is sleeping in positions like the supine position where the AHI is more. And it can even be monitored on this either directly you can have vibrations, or also it can be monitored on an app. And then we have this device called Excite OSA, which gives neuromuscular electric therapy for the tongue muscles. So daily, the patient is instructed to use it on the tongue in intervals of 30 minutes, 2 to 3 times a day. Over a period of time, it creates more tone in the muscles, and then again helps in preventing collapse. And these are magnetic implants where diametrically opposite magnetic fields are used. One set of magnets are implanted into the pharynx, and then we have a band outside with opposed magnetic field. These will stabilize the pharynx, help prevent flutter, help prevent collapse, and this can dampen the vibrations in the tissue that occur during snoring and sleep apnea episodes. This is something that is still it's in the research phase. We do not know how this is going to be, whether it's really going to come out in the market. It's a disposable micro CPAP device that is battery operated, extremely light, just sits on your nose and helps prevent airway collapse by employing a microfluidic pump design. So it's been being researched and marketed as airing. I mean, still in the research phase, developmental phase, not yet in the market. So we do not know if this is going to come or no. So this is in brief about certain non-surgical and non-CPAP modalities of treating OSA that I could summarize in 12 minutes was what I was 12 or 13 minutes, and 2 minutes for a question and answers. So I come to the end of my presentation. If there are some quick questions, I'll be happy to take them. Thank you.
Thank you, doctor.
Yeah. Good evening, sir. Very informative, sir. A lot of new things.
Thank you, sir.
One doubt is you told you showed lot of devices. If you would like to suggest only one device for a patient who was operated previously and presented with recurrent symptoms or a failure of surgery, which device would you suggest, sir?
Okay, device right now gold standard is CPAP.
Yeah. Apart from
CPAP, that, we have the intraoral negative pressure device, the INAP device. These are the only 2 devices available in India, apart from the mandibular advancement device. Like how we have been speaking about this, the site of collapse is very important.
Yes.
If it's a tongue-based collapse, the mandibular device helps stabilizing the mandible. Again, if it's an oropharyngeal plus a tongue base, INAP helps. The INAP negative pressure device helps.
Okay, according to the site, you will suggest.
Better,
Yeah, yeah.
according to the site, you can use
Thank you,
it,
sir.
sir.
Thank you.
Welcome, sir.
Thank you, doctor.